Coming up next on Arizona Horizon, we'll learn about efforts to sign people up for medical insurance before an upcoming deadline in the Affordable Care Act. The Phoenix Symphony's Michael Christie talks about conducting a prize-winning opera set for broadcast this week here on PBS. And we'll see how ASU's Tempe campus is a surprising source for fruits and vegetables. Those stories next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Eight, members of your Arizona PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. Arizonans thinking of getting health insurance by way of the healthcare marketplace are facing a December 23rd deadline to ensure coverage by January 1st. A campaign titled Get Covered America is underway to sign folks up before that deadline. For more, we welcome Patty Arias of Enroll America Arizona. Good to see you. Thanks for being here.
Good to see you, Ted.
What exactly is Get Covered America?
Well, Get Covered America is the campaign that is nationwide, and we're focused primarily in different states, such as Arizona, Florida, Georgia. There are a number of states where we are going out to the public and reaching out to people that we believe may be uninsured and talking to them about what their options may be under the healthcare marketplace. We go to public places such as farmers markets. We go to places like grocery stores, college campuses, places where people may gather where we believe that a large majority of them may need some information when it comes to signing up for health coverage.
Basically set up a table or have people just standing around with it with pamphlets and information and those sorts of things?
That sort of thing, yeah, absolutely. It's very basic, it's very low tech, but we will have people who set up tables at, say, libraries, public libraries, places like that, where we'll ask them, are you covered? And if you're not, would you like some information? Let's talk to you a little bit about what you may be able to benefit from under the healthcare marketplace. And then we give them information about how to get in touch with people who can help them enroll if they have questions about what they might need to do.
I was going to ask, are there people with Get Covered America standing by on telephones to answer calls, or is it more of a proactive get out in the community kind of thing? How does that work?
It's really more of a proactive educational type of an effort. So we reach out to people to give them, a lot of people say, okay, well, yeah, I know a little bit about this healthcare law, and I know that even though I have diabetes, I might be able to get some type of health coverage, but I don't know the first idea about what to do. I don't know what to do. I don't know where to go. How do I get some help? And so what we do is hopefully get in touch with those people or talk to those people or see them in a public place where we can give them the information and say, okay, here are some options. Here are the things that are different about these new types of insurance plans. And then we help them get in touch with application assisters or navigators who can help them take that next step, get information from them, and help them sign up and choose a type of plan that might fit their needs.
Is there a typical person with typical questions out there? What are you seeing the most? And when you see someone kind of walking toward the table, can you say, we see a lot of that kind of person?
You know, it really varies. A lot of the people that we see are people who didn't know. They've heard some sort of chatter about healthcare law, and they don't really know a whole lot about what's out there. So a lot of those people will be like, yeah, I've heard about this. Give me some more information. So we get in touch with a lot of people like that. We do hear from people who have the pre-existing conditions that haven't been able to get coverage, and some of them probably gave up years ago. We also hear from people who may have recently been laid off, but may have some resources to get them through for a little bit, but they may not be ready to look into a Medicaid program. So they're looking at different ways that they might be able to cover their families, either for a gap period or for some other purposes if they've decided to go into business for themselves or work on contract and that sort of thing. So it really does vary. But for the most part, there are people who are just interested in finding out more.
I was going to ask that. Are these folks are their questions more of a, I really don't know anything about this, but I've heard I better get involved, or I've heard a lot about this, I'm completely confused, help me?
A little bit of both.
Is there?
We do. We do get a lot of people who are confused, and so we do our best to try to answer any kinds of questions they may have. For example, someone may say, well, I've heard that I probably don't qualify. Well, you don't know that until you've gone through the steps to learn about it. So we do have a number of tools. We do have a website, getcoveredamerica.org. We have a calculator on that site that will help people sort of determine what they may qualify for, what their tax credit, tax benefit would be for signing up under a certain type of plan. We also have tools on the website that will help people get in touch with local people who can help them. Maybe there's an assister who lives or rather who works at an office that's 2 blocks away from where you work or from home, where you can stop by and get more information or have them sit down with you and go step by step through the application process.
And your computer site works?
It does.
It
Well, it's actually
does.
healthcare.gov, and it is in Arizona. We have the federal marketplace that is running the exchange for us, and we have seen an uptick in the number of people who have applied for healthcare. Initially, in the month of October, we were looking at numbers that were just over 700, which was remarkable considering that the website was down much of the time.
Yes.
What we've seen in the month of November, and consider that the website really wasn't functioning well until the very end of the month, 3,600 people. So we're seeing quite a few people now able to access information about the plans, choosing a plan, and selecting one that they can have so that they have coverage by January 1st.
That uptick or surge, if you will, in numbers seems to coincide with national numbers as well. Is it because the website seems to have settled down? Is it because people do realize there is a deadline for this first go-around?
From what we understand, it's a little bit of both. That people rarely sign up for something when they're told, okay, you have this much time to sign up for something. So, okay, October 1st through December, mid-December is the time period that you have to sign up so that you can get coverage by the 1st of January. We rarely see people starting, and I'm guilty of this too. I'll wait till maybe December when it rolls around. I'll sign up. So I think we have seen that type of a trend in other types of programs where people were having to meet a specific deadline. People tend to go toward the latter part or closer to the deadline when it comes to signing up.
And they get more frantic, I'm sure, as the deadline approaches, because if you have questions, if you are confused, you have less time to figure it out.
That's right. That's right. And so that's why we're really stepping up our efforts right now to get out to the public and just remind them, look, you've got less than 2 weeks if you want January 1st coverage. Now, the marketplace itself is open until the end of March. But if you have a pre-existing condition, perhaps you've been waiting for years, and in some cases people may have been waiting for 10 years to get coverage because they have high blood pressure or have had a heart attack in the past, and have been denied coverage under a private plan in the before. For a lot of those people, they can't wait, and so they need to know that that deadline is the 23rd of December.
Okay, and for people that are confused right now, December 23rd deadline ensures coverage by on January 1st.
That's correct.
What happens if you miss the deadline? Is there another enrollment period? You mentioned the March thing,
Right.
but I mean, will people be penalized if they don't have insurance come January 1st? Is that the March deadline as well? What happens at the end of March if you don't have the insurance? A lot of dates kind of here.
Right, right. And I think that it's easy to get confused by a number of dates that are out there. So we try to focus on, okay, here's our next deadline, which is the 23rd, if you need coverage by January 1st. If you don't meet that deadline to get January 1st coverage, then you can continue to enroll. And then your plan will start the following month, depending upon whether you meet a specific deadline each month. So for example, if you enroll by January 15th, your coverage will start the 1st of February. So you have to meet those 15th of the month deadlines. Now, when we talk about penalties, a lot of people will say, well, I'll just pay the fee. I'll just pay it.
Yeah.
But the greater fee comes when, say, for example, and I know of a number of cases, I thought it was initially just a coincidence. I had a young friend who was hit by a car, and he didn't have insurance, $15,000 in hospital bills.
Yeah.
And I saw him in the hallway at a theater one time, and he said to me, he says, I'm still getting hospital bills.
Yeah.
And then another one, and then another one. So I met a couple of different kids that were running into this same situation. So the greater penalty isn't so much the $95 fee or the 1%, it's that penalty that you will have to pay if you get an emergency room bill and you don't have insurance.
And again, the 23rd of December means that come January 1st,
Right.
you're done. If you want to chance it for 2 weeks till January 15th and you can chance it for 4 weeks, I guess, and get covered February 1st, you can do that. Doesn't make a heck of a lot of sense, though, when it's waiting there for you right now.
Right.
What is the website, again, that people need to go to get more information?
To get more information, they can go to www.getcoveredamerica.org, and we do have a number of tools and places that you can go to find a local assister in your area.
All right. Very good, Patty. Good to see you. Thanks for joining us.
Good to see you. Thank you.
The premiere production of the Pulitzer Prize-winning opera Silent Night will be broadcast nationwide this week on PBS's Great Performances. The opera airs Friday night at 8 p.m. here on 8 Arizona PBS. Conducting the Minnesota Opera's premiere performance is the Phoenix Symphony's own Michael Christie, who joins us now. Good to see you again.
Good to see you too.
Okay, so this is the Minnesota Opera's premiere of Silent Night. Are you going back to do it? Was it already done? Give me a timeline here. What's going on?
The performance happened in November of 2011,
Okay.
and then the Pulitzer was this past year, 2012.
And this is going to be broadcast on Great Performance. Did you know this was going to be a broadcast performance?
No, but we did understand that this was going to be an important opera when we were doing it, and so we fundraised a little bit more to be able to capture it on HD. So the image is amazing, and the sound capture is out of this world. And then it was just a question of whether things would be picked up, but I think the fact that it is this kind of Christmas opera
Yes.
did give it a great opportunity, and so PBS picked it up.
You said you knew at the time this was an important piece of work, and this was kind of a special opera. Why?
Well, there are those moments when creating something brand new, when you just know that a composer, and in this case, composer and librettist team, have really hit it. And they just have created this fantastic story, and the propulsion of the drama, the beauty of the music, and just the topic somehow really worked.
Well, and to talk about the topic, because when I read about it, it's like, this is, we've heard this story before. This is kind of a historic story, but World War I, soldiers kind of laying down their arms during Christmas. But the idea of a song from this bunker, a song from that,
Yes.
My goodness, that's made for opera.
It really, that's exactly it, and that's the point. And when Minnesota Opera commissioned this particular piece, that was the idea, that when you have something as upending as war, and then suddenly music
Yes.
changes it. And what's so interesting is that reports are that these kinds of armistices happened throughout the battle lines. It wasn't just this one, but this actually did happen in Belgium, and the three armies, the Scots, the French, and the Germans, who were apparently quite close together. So close were the bunkers that they were just shouting at each other
Yeah,
often.
yeah.
And then apparently in real life there was a German singer, and he started singing, and then the other people started to sing, and then they popped their heads over the bunker. Okay, what are we going to do? And then they got together, and there was a soccer game. And they did have a church, a service happen.
Yeah.
The one thing that we did add in the production is we did have a love interest added.
Did
Because
you?
need
All right, well.
This is opera.
All right, I was going to say, all right, I never heard that part before, but we'll have to wait and watch that on Friday night. Scenes sung in the particular languages?
Yes, this opera has 5 languages.
Wow.
Starts off in Italian because the love interest is between a soprano and a tenor, and so they're singing in Italian because they're opera singers. And then we go into the bunkers, and we hear English as for the Scots, French, German, and then the soprano, when she does come into the bunkers as part of the story, she is part of the service, the Catholic service that happens, that a Scottish priest who was in the bunker, the Scottish bunkers, holds for all of the soldiers, and she sings in Latin. So that's our 5th language.
The music, I want to get back to the story in a second here, but the music itself, is it atonal? Is it melodic? Is it percussive? Is it modern? Is it old-fashioned? What is it?
It's a real mix, just like the mix of languages. The first thing that people will hear is hearkening back to Mozart with that Italian opera feel. The battle scene is quite atonal because it's battle,
Yes.
but the majority of the music is very beautiful, tonal. It has a lot of rhythmical drive to it. Kevin is just a tremendously gifted composer who had been writing for instrumental forces, and this is his first opera, and it won the Pulitzer.
Yeah.
He has navigated all of the sometimes hurdles of writing for the voice, and particularly voice with orchestra.
What are those hurdles?
Well, it's very interesting because obviously when we speak with each other, there's inflection
Yes.
in how we stress certain words in a sentence. And so composers through time have made their mark by how they use musical gesture to make that inflection happen and to make the stress happen in the way that the lines are communicated. I think that's where modern vocal music can get a little touchy because I think particularly in the middle part of the 20th century, it was quite disjointed.
Yes,
and I think
yes.
it just didn't resonate with people.
Yes.
And Kevin really has gotten back to that natural stress of the storytelling, the communication of that particular line in a very, very clear way right from the beginning.
Fast-moving opera, slow. I would imagine maybe a little slower considering the reflective nature of everything, but maybe not.
It's pretty fast moving. It's a pretty short evening. I think it comes in about an hour and 50 for the whole thing. And there are moments of repose for sure. In the first act, for people who watch it this Friday, there's a beautiful sleep chorus. I should say that there are only 2 women in the show. The rest are men, because obviously we're in the bunkers of armies in World War I. No women serving yet.
Yes.
And so we have the love interest, and we do have the wife of the French lieutenant, who is very brief. But we do have a beautiful a cappella men's chorus where we see the 3 bunkers before they start to interact with each other, and they're all singing about sleeping and reflecting on being home with their families. And it's really wonderful.
And that brings me to because that sounds wonderful. And that brings me to my next question. Considering the subject matter, considering how opera, the hankies can come flying at any moment there with that, how do you keep it from being, is it schmaltzy? Does it get close to schmaltzy at all?
I don't think so.
Yeah.
No, I don't think so. I think that was one of the key tasks, was to be very honest to the story and not letting it get to that point. Obviously, when those moments happen and a couple of the soldiers die and it's very intense, you have to respond to it, but we didn't dwell on it. It is truly remarkable, and what we're so proud of is the fact that many opera companies have picked it up since, and this is only, it's only 2 years old.
Yes.
This year it's showing in Cincinnati, Fort Worth, Calgary. Just this year alone, I'm doing the European premiere next year in Ireland. And there are 4 other companies that are about to announce productions for next year.
Well, that's fantastic. Yeah, I didn't. Just sometimes you hear some of these stories, and you know that, boy, if you do this the right way, it can really touch a chord. If you do it just a little bit off, it can kind of go a little bit.
Right.
So we're at Hallmark card here. We got a Hallmark card.
Yes, that's right. Exactly.
Last question about this: challenges for you conducting this kind of music, this kind of production.
Well, the biggest challenge was the fact that we were creating it from scratch. We had no history, there was no record. We were creating it together. This was the original creative team, and so the director and myself were working closely with the composer and the librettist to try to tease out what they were looking for. They were giving us a lot of feedback, and vice versa. But it's Minnesota Opera, which I'm now music director of. This is a long-range project. We commission a new opera every year.
You're music director at Minnesota Opera, but you're still with the Phoenix. How does this work?
As music director laureate.
Music director. Okay, so
Yes.
You got from Minnesota probably in the summertime, Phoenix in the wintertime.
Something
Is that
like
how it
that.
works? Okay. We can't let you go without Handel's Messiah. That's going on. Is it going on this week now?
It is. We start tonight, actually. I'm going to Mesa after we finish the interview today.
And talk about the challenges of conducting that. I'm assuming you've done this numerous times.
Many times.
But man, that's quite a production.
Well, it's a funny thing, actually, because so Silent Night we had to create from scratch. We had to create our own tradition. And then you have Handel's Messiah, which is bathed in tradition, 250 years worth of tradition. And so it's the same thing, though. Handel, who is also a great opera composer, gets right to the heart of the matter all the time. Very concise, lots of drama, lots of impact without wallowing.
Yes.
And so I think all one has to do in any of these situations is tell the story. Tell the story honestly, tell it as if you were speaking to somebody, trying to convey that for the first time, and it comes across like gold.
Well, we can't wait to watch this Friday night. This is pretty exciting stuff.
DVR it if you can't watch it live.
Yeah, and of course on the PBS websites as well. And of course, the Messiah is always great. I can't let you go though without the personal question. I just love talking about classical because I don't know much about it, and I enjoy learning about it. What's new, fresh, interesting? I don't want 12-tone. I don't want atonal serialism. I don't want to be an egghead kind of stuff. I want what's happening out there. What's exciting you about classical music?
Well, very interesting. I think all of those stereotypical modern sounds really are a thing of the past. This is like 1960s to 1980s. That really is gone. It is much more melodic language out there. There are actually some beautiful interfaces with electronic enhancements in certain ways. It's a very exciting world. One thing that I think is really special is that a lot of orchestras are breaking down into smaller ensembles, sending their people out into bars, into other venues that are more intimate, in addition to those large venues. And so that calls on different kind of repertory, different experiences. I think orchestras and opera companies are trying very hard to connect with people in new ways.
Excellent. Well, there's going to be Connection Friday night, that's for sure.
You got it.
It's good to have you here. Congratulations on the
Great
performance.
to see you. Merry Christmas.
Billy Von Nero heard them say in an Arizona town one day that a band of Apache Indians were upon the trail of death. Heard them tell a murder done, 3 men killed at Rocky Run. They're in danger at the car ranch, said Von Nero under breath.
Arizona State University is home to a unique group of volunteers, and as producer Shauna Fisher and photographer Steve Snow show us, some of the volunteers on the Tempe campus are putting their green thumbs to good use.
Miles Campos is spending the morning picking grapefruit, not in an orchard, but in the middle of ASU's Tempe campus. Miles is part of an all-volunteer program run by Deborah Thurkill.
Campus Harvest is a program here at ASU that we harvest everything on campus, from our dates, our sour oranges. No one goes hungry on our campus.
The entire 750-acre campus is an urban garden with an edible landscape, all available to the students. It was the vision of the former ASU president, Laddie Coor. For Miles, the concept behind an edible campus was a welcome one.
Coming from out of state, I really, when I first got to Phoenix, and especially ASU, all I saw was desert, and it seemed sterile to me. Nothing grew, and it was just empty.
Miles soon learned there was more growing here than he realized, including date palm trees.
ASU is unique in that we're in the Sonoran Desert and we can grow these date palms, and that is so unique to this area.
ASU's groundskeeping crew harvests the dates that grow on 80 trees throughout the campus. Volunteers package them, and then they're sold at campus bookstores and farmers markets. They're also used in ASU's dining halls. Nearly 5,000 pounds of dates are harvested in a single season. Campus harvest extends beyond the trees.
In my plot right now, I have Brussels sprouts, beets, and carrots.
Miles and about a dozen other students have their own gardens growing on the south side of the Social Sciences building.
Feels good to be a farmer. It's almost like a spiritual experience for me. You get the dirt under your fingernails and you make something, and it's a really wonderful experience.
The students are given an 8 by 10 foot plot and can plant whatever they want: peppers, squash, even herbs. The only requirement, they have to maintain their own garden. They're also free to do what they want with the fruits of their labor. They can sell the veggies at farmers markets or to ASU's campus dining. They can give them to friends or keep them for themselves. Bianca Zaital, who is a biology major, sees this as a chance to experience firsthand what she studies in the classroom.
When I walk around campus and I see the variety of plants growing, edible, non-edible, it makes me happy to see that there is this sort of integration of flora and people. Being able to see where your fruit is coming from, especially the dates, which are sold on campus, it kind of creates this sense of unity in that you know the origins of your food, and so you can appreciate where it comes from.
Miles, who spends most of his day on a campus the size of a small city, relishes the opportunity to do something with and for his community.
We're growing it, we're maintaining it, we're eating it. It's staying here, it's staying in our community, it's local. We know the quality of the food, and it's just a wonderful experience to know that you're supporting your classmates and your friends and feeding each other.
And that is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.
Arizona Horizon is made possible by contributions from the Friends of 8, members of your Arizona PBS station. Thank you.